Serious doctors of Reddit, who were your dumbest patients? I worked at the during my internship and met a girl who had increasingly painful and red eyes since a couple of days back. The last 24h had been horrible. I asked about all the normal stuff and she claimed to have no idea why she had this eye problem. She had never had anything wrong with her eyes. I proceed to drop some dye in her eyes to check them in a microscope, and when I do I realize she's wearing contacts. She didn't like her natural eye color, so she had bought a set of blue colored lenses 8 months earlier. Never removed them, not even during nighttime. Didn't even think to mention this to me. Claimed to have no foreign materials in her eyes. Needless to say, I gave her quite the harsh lecture and a referral to an ophthalmologist. I met one who was taking lactulose extra strength laxative for her lactose intolerance. There was one who was very upset to find out that she was pregnant again because she'd used her diaphragm exactly as she'd been told. She carefully inspected it for holes, applied the spermicide, placed it, wore it at night, then took it out, cleaned it and put it away each morning. And then her husband arrived home from his night shift. I posted this a while back when a similar question was asked. GP here. The most outrageous thing I've heard was from a boy who was something like 20 to 22 years old. Very poor, illiterate family. The boy had a bad case of tonsillitis and refused to take any meds because all he needed to do was bite the sun. Basically at noon he had to look up to the sun, open his mouth as wide as possible and bite the sun several times so it would burn his tonsils and cure him over the course of a couple weeks. When that wouldn't work, plan B was to do the same at night, but only under a full moon. TL, doctor, bite the sun and cure you tonsillitis. Had a patient who was convinced that drinking grape juice with baking soda was helping him fight prostate cancer. But your cancer is actually getting worse. I'm gonna stick with my plan. I really feel like it's helping. Edit. Yes, it is kind of like Steve Jobs. You can all stop replying that now, because we all get it. Probably the diabetics who get admitted and then get put on a diabetic diet, but eat McDonald's / Popeyes / KFC / Pizza Hut that their families bring. Usually I hate the family and the patient. This was the #1 reason why I hated internal medicine. I'm a nerd document. I once had a 20-year-old and his girlfriend come in at 2 AM freaking out because something had tore his throat open. He seemed fine. No blood. Breathing fine. I had him open his mouth. Saw nothing. So didn't want him to lose confidence in me. Clearly something had happened. So I'm looking and looking. There is nothing wrong with this kid's throat. Finally I say, look, it seems okay. What do you feel or see? I don't feel it, but look, it's right there. Where? Looking. It was his uvula. Somehow this kid had gotten to the age of 20 without ever noticing his uvula. Girlfriend was also horrified. I told them it was normal. Did not believe me. So I told them I was about to blow their minds and showed him his girlfriend's uvula. Minds blown. Another life saved in the air. We had a patient come in for theater. When asked if she'd followed the fasting instructions she said yes, but luckily the nurse didn't believe her. With some prodding the patient eventually confessed to having 6 chocolate bars and an orange juice for breakfast. Obviously the surgery was delayed. We had a patient once on a PCA, a kind of pain medicine pump with a button that the patient pushes to dispense more medicine. She thought she had to physically lick the button in order to get the medicine. It was weird. During a fellowship in oncology I had a nurse call me downstairs to discuss a patient. He was on a phase 1 clinical trial and we needed to check trough values to see what his dose limit would be. We started out at 10 mg in the form of 2.5 mg X4 tablets, so his dose could be modified without redispensing. Well, he could not comprehend the amount of pills he needed to take. Just did not understand that he needed to take only 4 every day and he had a month's supply. We had to physically withhold his medication and have him come to the infusion center every day to take his medication because he would have otherwise overdosed and died. How hard is it to understand you take 4 tablets a day? There was the guy whose elderly mother suffered a massive brain hemorrhage and I had to tell him there was nothing surgically we could do for her. He tearfully told me that he would do anything for his mama and she could have his brain to save her life. Dude wanted us to do a brain transplant. I had to tell him that no, unfortunately that would not be possible. This guy takes the cake by leaving dozens of needle tips in his neck. My best guess is that he was reusing needles by heat sterilizing the needles a little too well, causing the needles to lose their temper, become brittle, and break off. We had a woman that went through 3 hospitalizations for diabetic ketoacidosis in 6 weeks. Her glucose was up to 1100. Her explanation is that she didn't like her endocrinologist, so she refused to go back. Our leg necrotic with maggots. Has been this way for 30 days. Wrapped t-shirts around the leg, and when the outer layer was soaked with pus they threw another one on top. He finally called 911 for shortness of breath. He died from septic shock. My breath smells like trichomonas part gets. Told she required urgent surgery after a shoddy home birth. Give her instructions including nothing to eat. Walk in to bring her to the OR, and she's scarfing down Burger King. Tries to hide it. After she sees me, Part is informed to begin taking Eliquis immediately anticoagulant. They just got a cardiac stent placed and told the risks of delaying taking that medication. The pharmacy was out of it for the weekend. She comes in 3 days later with the same chest pain as before. I thought you fixed me. Is my doctor stupid? Me. I had a patient who came to the emergency department vomiting so much I had to admit him for intravenous fluids. I took the usual history, including what he'd eaten recently. Nothing out of the ordinary. A few hours later, he calls me over. Doctor, I did eat some chicken and rice earlier. My girlfriend made it yesterday, and we left it in the pan on top of the stove overnight, and I ate it this afternoon. This was in a July heatwave. Do you think that could have been it? Yes, I do. Size we had a little talk about food hygiene. Scribe. One time this guy came in with a radish and a mouse shoved up his ass. He was summarily taken into surgery after everybody had a good laugh at him. 14-year-old couple splitting birth control pills to be extra safe. Girl gets pregnant. Boy gets gynecomastia. While reviewing a new patient's medical history, this 30-some-years-old lady tells me that she has the worst pseudo-seizures her neurologist has ever seen. For the medical professionals, that sentence says so much. Girl came to the ER for nausea/vomiting. Tried to give her some Zofran. No thanks. I'm not really a medicine type person. My body rejects chemicals. Took care of a patient who I diagnosed with non-Hodgkin's lymphoma. This sweet woman is her late 20s. For those that don't know, NHL responds pretty well to chemo. Her father-in-law had a business selling camel's milk. She opted for a camel's milk treatment plan over chemotherapy. She was convinced that camel's milk can treat anything. She said she came to the hospital just to find out what it was that she was going to treat with the camel's milk. SMH. She had a 2 and a 4-year-old. Fortunately, I could convince her to only try camel's milk for a finite amount of time and then follow up with our oncologist to see if camel's milk did the trick. Edit. Typus from speech to text. Once a boy had a cut on his skull due to head injury, and his parents applied tea powder to stop the blood flow. Common situation. Do you take any medications? Just aspirin. Okay, great. Later on, do you have any numbness or tingling in your legs? Yes. From the diabetes. Oh, you're diabetic? Yeah, but I'm taking meds for that. Okay, sounds good. Any other medications? No. Okay. Later on, how much are you exercising? Well, I try to walk a couple times per week because of my blood pressure. Oh, you have high blood pressure too? Yes. Are you medicated? Yes, subconsciously thinking, damn it. I remember once on rounds with the team we walked in on a cardiac patient doing a line of coke in the hospital bathroom with his girlfriend. Had a 70-year-old female come in with a broken rib and clavicle after falling. Tells me her only medications are insulin and Tums. While taking her history she seems off. She's acting confused. Her voice is deep. Her face is swollen, and she's had been having balance problems. Textbook hyperthyroidism. Turns out she had her thyroid removed a year ago. When I asked her if she was taking any medications for that, she tells me yes, the Tums. I need the calcium for my thyroid. Where she came up with the idea that Tums were a great substitute for your thyroid, I will never know. Needless to say, she left with a new synthroid recipe. I'm a nurse practitioner. I did a pelvic exam on a young woman and removed a homemade ceramic satanic doll. She kept it in her vagina. You see, it had the head, horns, and hooves of a goat, the body of what seemed to be the Cookie Monster, and she had tied a felt cloak around its neck. I used forceps to extract this amazing art project and asked her, "Do you want to keep this?" My poor co-fellow at the time had a newly diagnosed Crohn's disease child under his care, who is in a gypsy family whose mother won't admit to being illiterate, and as a result her son's care was being compromised. On the way out of clinic, I overhear the following conversation. Gypsy mom: "Oh, actually, doctor, I have one more question. Can you prescribe him something to get more girls to be attracted to him? Doc." Huh. Gypsy mom: "Because we've tried all of the Axe body sprays and none of them seem to be working." Doc: "You mean like a magic potion? Sorry, can't help you there." While in nursing school, I had a patient who had wounds on his leg and refused wound care because hospitals are clean and you can't get an infection in a hospital. He refused even after having me, and then my instructor explained to him about hospital acquired infections and the need for wound care.